A few weeks ago, we chatted with Dr. Mark about metabolic syndrome, what it is, who it affects, and what can be done to prevent it. Now, we've had a number of questions from viewers asking for more information. So today we're going to be digging a little bit deeper into metabolic syndrome and what you need to be doing to manage this condition. Mark, good to have you back. Lots of reaction to this discussion. I think a lot of people recognizing it. So let's just do a very quick recap for those who weren't part of the discussion last time as to what metabolic syndrome is.
Okay, so easy. It's a cluster of conditions that increases your risk for heart attacks, strokes, cancer, diabetes.
Right.
It's related to insulin resistance and the functioning of fat cells, and it presents as follows. An increase in obesity for men. It's an abdominal circumference of above 102, for women above 88. Blood pressure that elevates above 130 over 85. Change in the cholesterol levels, not total cholesterol, but distribution. Your HDL cholesterol, that lowest, that's the good cholesterol, to below 1. Your triglycerides, which are your fatty component of cholesterol, elevating above 1.7. Fasting glucose, that elevates above 5.6. Decrease in sex hormones, thyroid dysfunction, but the biggest one, check the abdominal circumference.
All right. So visually, there's a quite a.
That's the only sign that you have.
Right.
Is I'm expanding around my middle.
Right. So you mentioned last time that you've got to have a number of these elements that you've just discussed now for a diagnosis. So
yes.
Say you've been to your physician, your practitioner, whoever, they've now made a diagnosis. So you know you've got metabolic syndrome. Where do you start in terms of starting to manage this syndrome? And also the next question that I want to add to that is this something that has to be managed, or is it something that you can overcome completely?
Okay, let's start with this. Is it something that you can cure? Very difficult.
Okay.
Is it something that you can reverse the progression to serious complications? Yes.
Okay.
So management starts with lifestyle changes, Michael.
Right. And just to touch firstly, it's very important that we get this under control.
You
Number
need to
one
get
thing
this under
so that
control.
it can be managed.
As we said the last time we spoke about this is the new pandemic. The numbers have increased exponentially, and it's increasing year on year.
Yes.
The complications, heart attacks, stroke, diabetes, cancer, none of us want that. It's a burden on our health systems, and it's something that can be prevented.
Absolutely.
So, you know what, identify the problem, diagnose the problem. So actually, yes, this is what you have, and now start the management.
Okay, let's get into the management. Sorry, I interrupted you. Lifestyle first, boom, where we go?
Absolutely. Number one, it's a healthy diet. So on this program, we have beautiful discussions from people like Dr. Nikki Roberts about managing your diet. So simple, Mediterranean diet. If you want to have a healthy diet, it's the Mediterranean kind of diet.
And it's a great diet. It's enjoyable too.
Isn't it the most amazing food?
Yeah.
It's vegetables, it's fruit, it's nuts, it's legumes, it's whole grains, it's fish, lots of olive oil. Actually have a teaspoon of olive oil a day. We always consider dairy to be something that can increase your cholesterol levels. Actually, dairy is brilliant as part of a Mediterranean diet to lower your cardiovascular risk.
Right.
So diet.
Okay.
Exercise. 30 minutes of moderate exercise per day. And after a week of looking at the other people's gardens, now time yourself how long that takes you.
Okay.
And the next day, see if you can shave a little bit of your time off. One block, no more than that.
Yeah.
And then, you know what, as you can do this at a good pace and you don't feel exhausted, Now you go back and you do it twice, but at a leisurely pace.
Such a
So,
great strategy, because I think
exercise.
everyone thinks it's all or nothing with exercise, so they go for the nothing option because it's just the easier option.
For my patients with obesity, getting into an exercise routine, I tell them go and exercise in water. Don't swim, just get into the water and walk, because you take weight off your joints and you exercise against resistance.
Yes,
So
yes.
you're getting strength exercise as well as cardiovascular exercise while being cool. Sleep. I cannot emphasize sleep enough in managing metabolic conditions.
Right.
One of the biggest problems, as we said, is obstructive breathing. So if you are snoring, and if you wake up in the morning and you're still tired, you need a sleep test. And
Okay.
there's beautiful companies now that can do this for you in the comfort of your own bed.
Right.
You do not have to book into a sleep clinic. But manage your sleep, get good quality of sleep. Management of stress, this is part of lifestyle. Taking time to clear the voices out of your head. I think playing a sport, a team sport, something like padel, is brilliant because it's
Yes.
you're physically active, you're amongst other people, you have a little bit of socialization afterwards, and you do it for an hour. Do it twice a week, it's brilliant.
You're also, something that I read the other day, and just in terms of cognitive engagement in a game like Padel, because
Yes.
you've got to be focused. So it helps you to
Absolutely.
eliminate all the voices in your head that
Yes.
might be shouting the odds.
Absolutely. When it comes to managing of the conditions like hypertension, here you need to see your healthcare provider.
Right.
The types of drugs that is very favorable. There's lots of different classes of antihypertensive. We look at the ACE inhibitors and the ARBs, the angioreceptor blockers.
Okay.
Okay, so those are the two main ones. Add niacin, vitamin B3.
Right.
It's brilliant for vasodilatation.
Okay.
Vitamin C for stiff artery disease, but you have to add vitamin E,
Okay.
as well as vitamin D and K, but also in combination.
Okay.
So from a supplemental perspective, your B vitamin, specifically B3, vitamin C combined with vitamin E, and vitamin D and vitamin K.
Okay.
On the cholesterol levels, it's foremost managing your diet, decrease your sugar, and decrease the amount of free fats.
Okay.
So add good fats into your diet. Here we're thinking of your omegas,
Right. Yes.
your
yes.
omega-3 supplementations, and olive oil, avocado oil, brilliant. Half an avocado per day.
Okay.
And then your good dairies, your
Yes.
full cream dairies, not low-fat, full cream.
Absolutely. Absolutely.
So that's managing the cholesterol levels. Again, exercise will go a long way.
You can
in
see
doing
again
that.
how all of these things interplay with each other.
Absolutely.
Yeah.
When it comes to managing of diabetes, again, you need to see a healthcare provider.
Okay.
Here we can look at medication that sensitizes you to the effect of insulin, and that's where we usually start. And here we're looking at your metformins.
Okay.
Most people would have heard about metformin, but metformin also have favorable effects on cardiovascular health. If it's already towards the type 2 diabetes side, but then we might have to add other medications. And again, diet here incredibly important. Cut the carbs, all your carbohydrates, fruit included, break down into glucose. And the problem is more glucose in the system, you're going to create more insulin.
Right.
And it's the insulin which is one of the stress hormones and a pro-inflammatory hormone causing the inflammation.
Okay. Okay.
Gut health is absolutely tantamount in managing this condition. we've spoken about the microbiome on the episodes that we've done
Always
with you. I think Dr. Paolo often speaks about microbiome, as well as Nikki. I think what we need to understand is dysbiosis in the gut.
Yes.
Dysbiosis, these colonies of organisms start mingling and spreading. Now, what we need to understand is the differences between your prebiotics, your probiotics, and your postbiotics. If you have a gut issue, start with a postbiotic.
Okay.
To heal the gut. And here we're specifically thinking of things like butyrate.
Yes. We spoke about that with Dr. Paolo quite recently.
Butyrate is brilliant. It's a free fatty acid. You now get it in tablet form. Butter is a good source for it. And it also smells, if you find butyrate, it smells a little bit rancid. But that's what you want it to be.
Okay.
So butyrate for managing your gut initially is imperative. It helps with constipation, bloating, and then the permeability of the gut, which leads to toxicity in the tissue.
Okay.
Again, inflammation.
Right. And of course, Mark, you're known for your hormonal interest. Maybe that sounds a bit odd, but your interest in hormones, and obviously that also is always going to play a role when you're talking about this expansive body-wide condition.
Yeah, Michael, absolutely. You know what, we're discovering more and more hormones every couple of months. And what we need to understand is all of them are linked to one another in some form.
Yes.
And if we have a hormone imbalance, it creates conditions that are leading to metabolic disease. And here we're specifically thinking of menopausal and perimenopausal period, where estrogen level starts to drop, testosterone starts to drop, and there's that middle age spread, which is the first sign of metabolic disease. Changes in hormone levels in men, exactly the same. It has an impact on your immune system, it has an impact on your gut, it has an impact on your brain. So in my practice specifically, when we look at metabolic disease, or when we look at menopause, or when we look at erectile dysfunction, all of these conditions play a contributing role to what the patient's presenting.
Yes.
So you have to have a holistic approach, bringing everything back into balance.
Okay.
And it doesn't necessarily mean that it's going to be hormones, or it doesn't necessarily mean that it's going to be weight loss. It might be hormone related.
Yes.
And that's the trick, is you need to go to someone that can integrate all of this. And there's our lovely, very, very proficient integral practitioners available in our big centers.
Okay. And Mark, so people who would like to chat to you further about this, if they're sort of recognizing these symptoms in themselves, where can they get in touch with you?
Easiest is look for the T Clinic. We're here based in Johannesburg. The number is 010-824-1393. You can go and look at our website, www.thetclinic.com, and we're on social media. Follow us there.
Wonderful. Mark, thank you so much. As always, fascinating to chat to you about these things, because we go into such great depth. So thank you for sharing.
Thank you, Michael.